Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Just 2 months ago, on the 8th of March, India's health minister was quoted as saying that India was in the, quote, endgame of the pandemic. But in the past few weeks, India's COVID caseload has risen sharply. In fact, India accounted for 46% of new COVID-19 cases recorded worldwide last week and 1 in 4 deaths globally. So how did India get from relative calm to its new crisis, and what can the world do and learn from this tragedy? Tonight on the show, we have Professor Sanjeev Krishna. He's a professor of molecular parasitology and medicine at the Institute of Infection and Immunity in London. Professor Krishna, thank you so much for joining us on the show today. It's good to have you. Thank you for joining us. If I may begin our conversation.
My pleasure, Melissa. Thank you for having me back.
So let's begin with the situation in India, because India's scale and scale in terms of its population and its geographical size, it makes generalization quite difficult. The country is not a monolith. So how should we begin to understand the COVID-19 crisis that India is in now?
Well, the images, I think that these have been shared across the world, really, I find extremely disturbing, and I'm sure this will disturb everyone who watches what's going on at the moment. It's a tsunami at the moment in India. The question as to how it's got there, I think with COVID, answers are never simple, straightforward ones. It is a very big country, but we have to look and see I think 2 aspects really that have been critical. One is the existing healthcare infrastructure in India has been extremely poorly funded in comparison, for example, to the other BRIC nations. So it has one of the lowest GDP spends, and if you look at contributions from the private sector, they are extremely important because the national spending is quite low. So you've got a pre-existing, a very poorly funded health structure system. And then on top of that, I think you mentioned in your intro, the leadership, the messages, the central and state implementation of measures to try and control COVID, these have to be looked at also very, very carefully. I mean, if I could just, take on further the quote from, the Prime Minister Modi in January, it really, I think, struck a very false note, because he said, friends, it would not be advisable to judge India's success with that of another country. In a country which is home to 18% of the world population, that country has saved humanity from a big disaster by containing corona effectively. We all know, and we've all had this experience seen across the globe, that you cannot take your eye off this ball. You must be extremely vigilant at all times, because the speed at which this virus takes off when control measures are relaxed is incredible.
Sanjeev, it's been editorialized, over and over again that that leadership is in question when it comes to the question of COVID-19 and its management. Boastful and incompetent is an expression that's been used to describe not just the Modi government, but many governments around the world, in the West and in the developing world. But if we get away from that kind of polemic against these particular administrations, what is it that we can tell about them? Is it that they misunderstood the science? Is that what is essentially at the heart of this, their premature celebrations, putting themselves on murals or patting themselves on the back?
Sharaad, I mean, it's a question I've been wrestling with, and I'm sure my colleagues have also been wrestling with, my scientific and medical colleagues, for a long time now. Here's what I think. I think it is beliefs and belief systems, when they come into conflict with scientific advice, that determines what happens in terms of strategy within a country. Let me just explain what I mean by that. It could be a political belief system. It could be politics that decides, look, in this instance, we're actually not going to pay attention to having a lockdown, for example, because it doesn't suit our constituents. You know, sometimes it could be even religious belief systems that come into conflict with scientific advice. For example, you know, the Kumbh Mela, the very large religious festivals that were allowed to take place despite the fact that COVID was around. So, you know, thinking about this broadly, I think when you have a choice between, you know, reasoned, evidence-based, you know, scientific inputs, and these are presented, when the important points coming out of the advice are trumped by belief systems, I think that's where the real floodgates open for, and you're quite right, you know, it's not just India. It could be in many places in the world. We've seen Brazil, we've seen other, you know, we've seen America before Trump was taken out of office, you know, also exhibited features of this, and the UK.
Right. So, Professor Krishna, how do we go about thinking about this then? You know, what can help? I'm sure you've had some time to think about this, but what can help deal with the fact that sometimes it is the belief systems? Is leadership the solution to this? Leadership in science, leadership in medicine, leadership in politics. Is that what is needed to get over this sometimes two opposing factors of belief in science?
I think leadership is an absolutely key component, and part of that, or synergizing with it, or allied with it, must be clear communication, and where necessary, education. For example, about the use of vaccines and vaccine hesitancy. Leadership must, I think, also be leading the whole population, not just subsegments of it. For example, even in Malaysia, you know, there are areas that are reached far less effectively than others. If you go to Sarawak, for example, you know, there isn't a green zone in Sarawak at the moment when it comes to COVID. Why there, and why not in other places? Selangor or KL, for example, are also, you know, areas where the infection is really taking off. So leadership is key. Being a conduit for implementing the best scientific ideas is a key. Education and communication, not mixed messaging, these are keys. But all of that, I think, depends upon integrity with regard to doing the best for everyone, not just one's own constituents and one's own belief systems.
Sanjeev, didn't India come into this story with a lot of pluses? It is seen to be the world's, you know, pharmacy. It produces both, you know, branded and generic drugs. It has that infrastructure. You know, it is the home of the Serum Institute of India. Weren't these all advantages that India had that they could have leveraged on in terms of dealing with the pandemic?
Yeah, absolutely. And you know, these, what you're pointing to, the drug production, and now, of course, I mean, you know, India supplies 60% of the vaccines to the rest of the world. So, you know, it's the powerhouse for supplying vaccines for the rest of the world. These actually reflect also a great deal of human resource and human endeavor and human intelligence. And, you know, these are all resources that providing the right infrastructure is there, providing the right approach is there, providing there is transparency, providing there is dialogue, then these resources can be focused to deal with the pandemic. But, instead, what we see, for example, in particular areas is suppression of information or attempts to control information. Oxygen shortages are denied, or the numbers of deaths associated with COVID may not be being collected carefully. And science depends on being as accurate as possible with things like numbers, being as accurate as possible with scientific truths. So, we have to step out of this belief political system that seems to be dominating in some areas.
All right, Professor Krishna, we're going to take a quick break, but let's come back and continue this conversation looking at the future for India. More on this topic in just a couple of minutes. Stay tuned to consider this. Welcome back to Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our conversation tonight with Professor Sanjeev Krishna. He's a professor of molecular parasitology and medicine at the Institute of Infection and Immunity in London. Professor Krishna, I want to talk to you about variants and whether India will likely become a reservoir for variants of the coronavirus to perhaps develop and maybe become a threat to other nations. We're seeing Nepal, which is said to be suffering from the spillover effects of India's current COVID-19 surge. How are you how are you understanding the issue of variants, particularly when it comes to India's COVID-19 crisis?
Well, that's a very important question. The thing about these viruses is that they mutate. And mutation is a random event. And so the more virus there is, the more mutations there will be. That's just, simple maths. And so at the moment, India has a huge burden of COVID-19. And so the risk of having mutations is just much higher. But the same would have been true during surges in Europe or during surges in the Americas, for example. So that risk is always there. It is unpredictable as to what variants might arise and what properties these variants might have. So, today it's India, tomorrow it could be, who knows? I hope not, but it could even be Malaysia or another country. So, the approaches that one takes to deal with this, I think, apply across the board. And the most important thing is obviously to bear down on the infection using all the tools in our toolkit. And, I think, we mentioned before that there are now effective vaccines against COVID-19. And yet, even though India is one of the producers of these vaccines, I think it's only at the moment about 10% coverage. And Malaysia, it's even lower. So I think that, this is going to be one of the most powerful ways to try and address the infection and any potential variants as well. Because at the moment, it looks like, to a greater or lesser extent, different vaccines still seem to have the ability to suppress infections in most people. And
right. Professor Krishna, I want to ask you, because you said that variants could emerge anywhere. The virus could mutate from any source in any country. And I wanted to ask you what countries can do to prepare for that. Because I believe, genome sequencing is quite an important step in identifying new variants that could become more infectious or more deadly. Was India prepared for that? Are other countries prepared for that? I'm just thinking what Malaysia can learn from that.
Again, a great follow-on, because when I have been discussing, sometimes even on television actually, with virologists in India, the great plea has been to really ramp up sequencing capability for SARS-CoV-2 sequences. And you could say that exactly the same in Malaysia. I think it is a really, really useful piece of information, that sequence, and looking for variants and understanding if there are variants of interest, which is that we don't really know yet whether they're going to become, worse infections or what other properties they might have, or whether they are variants of concern, where we now have a feeling that these mutations, could cause more severe disease, could be transmitted more easily, or indeed might have some influence on responses by vaccines. So the strength of sequencing, its importance, was highlighted by one of the positive aspects of the way the UK has managed this infection, because that is one of the strengths in the UK. There may be many weaknesses, but that really was one of the strengths. And it's a great lesson to link up with this sequencing elements in the UK collaboratively throughout the rest of the world.
Sanjeev, one clear divergence between, I think, the Indian scenario and the Malaysian one is that the government here is committed to giving everybody the vaccine free of charge. And I understand in India, that's not true. And people are paying for their vaccines. And this plays into the stark inequalities that India already has. I mean, can the Indian middle class save itself if it cares nothing for its poor?
No, it can't. I think it's as simple as that. And I think it is the duty of every government, if we come back to basic principles, that health is a fundamental human right. And I think the lead of many countries to provide vaccines free has to be one that is implemented. My understanding, I mean, I had to look at this actually just before coming on, Sharaad, to see if the vaccines were being charged for. I believe some states are giving some vaccines free, but there is this dual system people can pay, and the private sector seems to be involved as well. Perhaps, I don't know. All I can say is that I think it's critical that everyone, as many people who can be reached to be vaccinated, should be reached, including the most hard to reach populations. Same in places in Sarawak, for example, which may be difficult to reach. These are the people, it could be migrants, it could be, displaced individuals, the deprived populations. We must reach all of these if we are not only for natural justice, which is a key point, but actually for self-preservation, because you've heard the mantra many times, no one is safe until everyone is safe.
Right. But if we were to come back to the case of India in terms of vaccination, 26 million people in India have been vaccinated. If you compare that out of a population of 1.4 billion, that's barely a drop. And I'm wondering if vaccination is one of the toolkits in India's arsenal, one of the weapons in India's arsenal, but it's not being fully utilized or may not be able to be fully utilized in the near future. What are we going to have to expect in terms of this COVID-19 tsunami, as you put it? Are there going to be further waves? Are you concerned about that, given how quickly this virus spreads?
Yes, I am. And, let's not forget that what we're seeing predominantly, I think, displayed on our screens is what's happening in the big places, whether it's New Delhi or Mumbai or whatever. And the worry is really, the real concern is that when this virus starts to, or perhaps is already spreading in rural populations, where healthcare facilities may be non-existent or even much harder to reach. So at the moment, there are so many problems to solve at different levels. Vaccination efforts just have to be accelerated phenomenally, and access to vaccines, both for the country and for the individuals in different areas. But at the same time, there has to be a capacity strengthening to manage the acute phases of infection. Why, for example, in a country like India, has there been such a dreadful oxygen shortage? Because preparations could have been made. Take the examples of a state that has managed things up till now very effectively and is now going to institute a lockdown to control its infection in Kerala. Here is a state that let's look back on it. Had the experience of Nipah virus outbreak and managed that, and then in the first wave of COVID-19 did extremely well, and is now taking control and instituting strong measures, whilst at the same time putting into place preparations in advance of the current wave of oxygen supply, drugs, and so on. Now, it may be that these measures themselves may not be sufficient. I hope they are, but at least there has been planning at some central level.
Sanjeev, is history a guide for scientists like yourself? The popular press likes to mention the Spanish flu. It was either 2 or 3 years for that to come under control. And with science much less developed and global connectivity much less, efficient, today, shouldn't we expect to, turn the corner on this much faster than the world did with the Spanish flu? Or are we looking at something so dissimilar that history won't teach us anything?
No, I think it's extraordinary actually how quickly things have managed to move. Just about a year from a new infection to vaccines that work, and they work remarkably well. And if you look at the mRNA vaccines, they've opened up a new way of dealing with not just infections, but other conditions like cancers and so on. So, I don't want to talk about silver linings in clouds when the globe is still suffering this pandemic, but it really is a very positive thing that has come out as well of this whole effort, this collaborative effort. But the old problems are still there, the inequalities, and what COVID-19 has done is to just underline and highlight and point out and cause us to relook at the enormous inequalities both between nations and within nations.
Yes, that's a very, very good point. Professor Krishna, thank you so much for joining us on the show tonight. Really do appreciate your time and you sharing your insights with us. Thank you.
My pleasure. Thank you.
That's all we have for you on this episode of Consider This. But don't forget to get all the latest news and information on COVID-19 vaccines. You can get that on the Astro AWANI app or at astroawani.com. Thank you so much for watching tonight. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We will be back with you for another episode of Consider This on Monday. Till then, have a great weekend and good night.